Dean Provencio Vasquez, professors, esteemed guests, students, thank you for inviting me to speak today. My fellow classmates, what a time we're graduating into. This last year and a half, we've all experienced loss, including the loss of our ability to be physically present with one another today. But I'm awed by what I've witnessed in your courage and willingness to persevere when things have been uncomfortable, uncertain, even dangerous. I'm proud and humbled to be among such a group. Congratulations. Before I was a nurse, I was a teacher. I loved being a teacher, sharing ideas, watching a student's face change with a spark of understanding. Most of all, I loved the humanity of teaching, the openness and presence that teaching requires. But one thing I missed was tangible, physical work. I like to work with my hands to create and hone and make things lovely. I like discrete problems and defined outcomes, and measuring a student's understanding was beyond my powers to quantify. So I decided to change jobs and look for work with more tangibility and definition. I decided on a job in healthcare. I considered becoming a doctor, a physician assistant, or a nurse practitioner. I chose nursing, and I was immediately taken with its physicality, the bodily presence that nursing requires. I felt settled, knowing that my new career would provide the tangible, technical work I'd been missing in the classroom. I was also taken by something I wasn't expecting. The human quality I loved in teaching was a defining feature of my new role as a nurse. This became clear in my first job as a bedside nurse. Like all bedside nurses, I started each shift with a long to-do list. One daily task, though, wasn't on that list. After physician rounds each morning, I'd follow the team to check on the patients they'd just visited. Too often, I'd find the rooms in disarray. Patients' blankets thrown back, bed rails down, lines crossed and kinked. In their goal of technically sound and efficient assessment, the rounding team often left the person they'd examined uncovered, exposed, bewildered. My job, unwritten but vitally important, was to help these people up in bed, smooth blankets, comb hair, and make sure they understood the whirlwind of medicalese that had just swept by. I'd ask, "What did the team say? What questions do you have?" Often, patients had no idea what the plan was or who had even been in the room. I took these moments to discuss diagnoses and plans when they might hope to go home. I'd leave the room tidier, but also knowing that I'd helped clarify and reassure. Every healthcare discipline has a particular value it brings to the table. But I think we have a tendency in healthcare of prizing the technical above all else, of putting all our faith in the ability of diagnostic tests to identify problems and the ability of medications and procedures to treat them. Indeed, that's why I initially chose to work in healthcare. But despite our best efforts and modern advances, people still get sick, still suffer, still die. We place our hope in our technical work, but often ignore a person's humanity, their dignity. I left teaching because I didn't get enough of the tangible, but in the hospital, there wasn't enough of the humane. It turns out, though, that I chose better than I knew when I became an RN and now an NP, because our work weaves together the humane and the technical. Our professional roots are at the bedside, being present in affliction as patients endure what technical medicine demands. Nurses understand, because we have seen, that the experience of illness has as great an impact on health as medication and surgery. We understand the science that underlies a problem, and we see the person who experiences it. It's this twofold vision that makes us unique among healthcare providers. We know that the physical exam is not just about what we see, but what patients have to share with us. We know that when providers only focus on the technical, they leave behind disheveled beds and confused patients. we know that our technical skills only get us so far, and that it is in our humanity and in holding up the humanity of our patients that we can hope not just to treat, but to heal. The motto on our university seal says, "Let your light shine." For us nurses and nurse practitioners, this motto is a unique invocation. For us, "Let your light shine" commands that we seek healing for our patients with all of the technical skills we have gained, while always tempering clinical expertise with human dignity. "Let your light shine" reminds us to insist on shining this light on the technical work we're about to do. I'm so grateful for my time here at CU and for the chance to work with all of you, my classmates and instructors and friends. My hope today is that we remember to bring our light and presence to cultivate a new approach to nursing that truly understands that the technical is limited until it is imbued with the humane. Thank you.